and it is my pleasure to present my proposal to you all today. The title of my project is Elevating Burnout in Medical School by Increasing Sense of Belonging and Collegiality in the Preclinical and Clinical Workplace. My supervisors are Professor Dr. Walter, Professor Dr. Jamwar, and Professor Dr. Sylvia. I would like to introduce myself. I'm a pediatrician in Ramatipadi Hospital, Faculty of Medicine, Mahidol University, Bangkok, Thailand here. My role in my hospital is a clinical teacher and mentor. There are 1,018 undergraduate students in a total 6-year program in my hospital, so my position is related to my project. As you may know that burnout is prevalent among physicians and as well as among medical students, especially in Western countries. But in Thailand, there is no data available now about the prevalence of burnout. Only some studies around mental health problems among medical students. Burnout has negative impact in many aspects, such as in patient care performance, mental and health problems. I would like to explain about burnout. It is a psychological condition consists of high emotional exhaustion, high depersonalization, and reduced personal accomplishment. Depersonalization is a negative, detached response from a job, and reduced personal accomplishment is feeling lack of achievement. From literature regarding precursors and impact or consequence of burnout, it can be organized into the job demands and resources model. High job demand can lead to burnout, and lack of resources related to disengagement. Burnout is an antithesis of work engagement. There are some literatures about intervention, but the effect of the intervention are relatively small. So a new strategy to reduce and prevent burnout should be investigated. From the job demand and resources model, to reduce burnout might be done by increased resources, by promoting resilience in workplace instead of improving life outside the workplace, and increasing social resilience by connecting to each other in the workplace and promote self-actualization. From Maslach hierarchy of need towards self-actualization, sense of belonging is the key step. Sense of belonging is achieved when persons perceive themselves to be an integral part of environment or that system, and feeling of being valued for involvement, feeling accepted, needed, and fit of individual characteristic. Faculty that lack emphasis regarding social interactions in medical students may lead to stress and decreased sense of well-being among medical students. Also, Maslach suggests that faculty should address burnouts, enhance teamwork, and build a culture of appreciation among by mentors and instructors. So faculty plays important role in this issue. In summary, promoting sense of belonging can increase resources in the job demand and resource model. So exploring the condition which promote a sense of belonging and collegiality among undergraduate medical students, as well as in faculty perception, is thus important to guide design a new intervention to alleviate burnout among medical students. And to measure the effect of intervention, an instrument is needed. The Maslach burnout inventory is a gold standard self-assessment to diagnose burnout among university students. However, a psychometric test is needed, especially for Thai medical students. So, from problem statement and gap in literature, read to my project. The first study will be explore about what are the psychometric properties of the Maslach burnout inventory questionnaire in undergraduate medical students. And this instrument will be used in the subsequent studies. It is quantitative study, consists of translation process and a survey distribution. Participants are undergraduate medical students. Descriptive statistic reliability and factor analysis will be used to analyze data. The next question is, what do undergraduate medical students perceive as the key factor to promote a sense of belonging and collegiality? This study will be explanatory sequential mixed methods design. The first phase is a quantitative phase using the Maslach burnout inventory survey, and then non-burnout students will be invited to participate. The second phase, which is a qualitative method using semi-structured individual interview, and participants in this study will be undergraduate medical students. The next study will explore faculty perception about key factors influencing a sense of belonging and collegiality among undergraduate medical students. Again, this study will be qualitative study using semi-structured individual interview. The participants are teachers in undergraduate curriculum, both preclinical and clinical years. And the last study will be design, implementation, and evaluation of an intervention to promote sense of belonging and collegiality among undergraduate medical students in workplace. The intervention in this study will be based on the study 2 and 3 results, and population is among undergraduate medical students. Then qualitative method will be applied using a semi-structured interview to explore students' experiences and the impact of the intervention. So from my project, we'll come up with an intervention to alleviate burnout among undergraduate medical students in Thailand, and hopefully that it can be generalizable to other medical schools in other regions. I would like to acknowledge my supervisors, Professor Dr. Walter, Professor Dr. Jamua, and Professor Dr. Sylvia for their great contribution to my proposal, and thank you all for being here today until the end of my presentation. Thank you.